Hello, everyone. Good evening. My name is Chivera from LDE TV, and welcome to Picking Brains. So today I'll be having a special guest. Her name is Lilian Ugboaja, Pharm Lilian Ugboaja. And we'll be discussing a very interesting topic, sexual health awareness. Well, this is a topic that most people avoid. Some people are shy about talking about stuff like this. They shy away from this topic. But today we'll talk about it, and we have someone special that will be joining us soon. She hasn't joined us yet, but before she joins us, let's talk about other things. How has your week been? I hope you're having a great week. So guys, okay, yeah, I think she has joined us, guys. Lilian, please, if you can see this request, I'll join. You will join the live. Just send me a request, Lilian. Lilian, can you hear me? Send me a request. Okay. Let's wait for her to send a request to join the live. So we'll start the show. Okay. Okay, I'm going live with her out right. Okay, let's wait for her to connect.
Hi.
Okay, I think she has joined us. Hello, hi Lilian. How are you doing?
How are you?
I'm
I'm
good.
good. How are you?
I'm fine. Welcome to the live. Welcome to Picking Brains on LDE TV.
Thank you. So good to see you. It's been a
Yeah,
long
it's good.
time.
Yeah, yeah, it's good to see you as well. Thank you so much for making our time to join us today. Thank you very much.
Welcome. You're welcome. Hi,
Okay,
everyone. How you guys doing?
yeah. Okay, let me allow you to introduce yourself. Tell the viewers who you are, what you do, and everything. Just indulge us.
Okay. Hi, everyone. Nice to see you, Vera. Actually, Vera
Hi,
has been
nice
one
to
of
meet
my
you.
childhood friends from when we were little.
Yeah,
So yeah. Hi, everyone. My name is
yeah.
pharmacist Lilian Ugboaja. I'm a pharmacist. I'm also a health and wellness expert. I also give advices on health issues. I've doubled as a customer care exec for a while,
Yeah.
and I'm a full-time hands-on pharmacist, healthcare professional. Just name it.
Wow. Thank you so much. Welcome to the show. So you already know what we're going to talk about today. It's a topic, as I said earlier, it's a topic that so many people shy away from. They avoid, involving in conversations like that. So today we'll delve into it. We'll talk about sexual health. So briefly, can you just tell us what sexual health is all about and like the importance and everything about sexual health? Just give us what you know.
All right. So, like you said, people shy away from talking about it, but
Yeah.
we understand that it's the 21st century, and the 21st century generation, we
Yeah.
indulge a lot in sex and sexual activities. I'm saying
Yeah.
this because it's good we get into the topic and
Of
tend to
course.
understand what it is. So, when the flyer for this program came up, and most were like, "Are you going to be talking about sex?" No. I'm going to be talking about how to take care of yourself, even while indulging in sexual activities. Basically, your total health. So we all
Yeah.
understand that most people are mostly sexually active. And in practice, I've seen that those who are, most of them don't know how to take care of themselves. It's not so much,
Yeah.
it's not enough for you to, be engaged in sexual activities. It's also important that you take care of yourself to avoid diseases, to avoid things that would make you, go sour, maybe along the way you go sour and all that.
Yeah.
So that's
Of course.
an important thing for a start. So what is sexual health? Like, it's not, sex is just sex, yes. But how do you
Yeah.
take care of yourself? So I'll just call it sexual health slash reproductive health. So we can say
Okay.
sexual health is the ability of men and women or of people to enjoy and express their sexuality and also prevent or become free from, risk of transmitting diseases, infection, unwanted pregnancy, discrimination, or violence. So you have
Yeah.
coercion also involved in, because we notice that most people sometimes are actually coerced into having sex. But now,
Yes.
That is just the definition of sexual health. But you know, when people hear sexual health, they'll be like, okay, oh, you want us to avoid a pregnancy, or you want us, okay, you want us to avoid unwanted pregnancy, or you want us to do better here or do better. No, this is it. If you are, we all understand that if you are okay mentally, that's a good thing. If you are okay physically, that's a good thing. But have we also understood that you need to be okay reproductive wise? Remember that reproduction is more like a system for procreation. That is one thing that is important in life right now. Yes. So that organ or that region of organs involved in procreation, why are we not paying attention to it? It's one thing to have sex, and it's another thing not to focus on taking care of yourself. So today we're just going to delve into the importance of sexual health. One, sexual health actually helps you take charge of your reproductive health and also your emotional well-being, so your surrounding and your intimate relationships. So like I said, most times in practice, we've come to see that many people have sex and they come and be like, okay, I need you to give me something. I'm a pharmacist, so I'm telling you from my own angle. I need you to give me something to flush my system. I need you to give me something. I just had how do I put this? I just had unprotected sex. I need to give me something to flush my system. Okay, no problem. And you come to me and you tell me to give you something to flush your system. Most people tell me, oh, please, Pharm, give me ampiclos and Andrew liver salt to flush my system. And I go and ask you, okay, what happened? What did you do? Most people shy away from talking about it. So if you don't talk about it to a healthcare professional, how would you properly take care of your sexual health? How would you properly take care of your reproductive health? Most people would would forget about proper hygiene and then come down with certain infections. How do you take care of yourself? You know, when we talk about sexual health, it's not about you having sex. Personal hygiene is also wrapped up into it. Do you understand? Yes. So that's one angle of it. Now, in statistics has actually shown, and before this program, I had actually done a little bit of research from my colleagues in other fields, like the doctors and the med lab scientists. And then most of them are like, presently, especially we women are actually mostly carriers of sexually transmitted infections. And there are more people running tests and coming out to be HIV positive, hepatitis positive. These people are not taking care of themselves. It's one thing for you, like I said again, I keep repeating it. It's one thing for you to have sex. It's one thing for you to be sexually active. We can't control your decisions and what you do with your life. But please, while you are at it, try as much as possible. Get tested, use protection, do the right thing, take care of yourself. You know, proper hygiene is important. So don't just have sex forgetting that there are consequences to these things. And you know, it hurts me more because you see young girls coerced or actually sweet talked into having sex and not actually taking care of themselves. They come up later on and start having infections leading to infertility. And when they grow up and want to get married and have kids, and you see some of them be like, they can't have kids, and then the notion of my village people are chasing after me, whereas you've not taken the time to find out, okay, what did I do that was wrong? Did I take something? Did I do something? Did I not properly take care of myself? So I think for emphasis, this is just more like an introduction of what we're going to do today. So.
Okay, that's very nice. Thank you very much for that. So there's a quick question I want to ask. So in Nigeria, we all know that the idea of sex education is something that there's nothing like that in schools. Even I went to a boarding school. I can't even remember them teaching me anything that has to do with sex education, right? So these young girls that grow up now, they don't have the idea. They don't even know where to start. You understand? And you mentioned something like people coerce these young girls into having sexual activities and stuff like that. Now, they were not taught about it at an early age. How do they go about it? Where do they get information? That's the issue. You understand? Because there's no sex education in schools. So many people shy away from it, and we've had instances where our parents will tell us, "Hey, when we were growing up, if a boy should touch you, you will get pregnant." You know, stuff like that. They don't. Our parents, they just they avoid it like plagues. They avoid talking about sexual activities like plagues. You understand? So how now will a young girl that wants to know about sexual activities, how will she go about it? How will she read about it or learn about it online or anywhere? I don't know. How will she go about it? Does she meet a doctor or a nurse or a pharmacy? How do you think young girls can actually go about learning about sexual sex education and stuff.
All right, Vera. We've actually been taught that knowledge is power. I believe
Yes.
if we are like I as a person, if I am well knowledgeable in something, I wouldn't be able to do it. Now, this is the thing
Yeah.
from the grassroots, from our parents.
Yes.
I'm going to give myself a typical example. My mom didn't like put so much emphasis on the don't do sex kind of thing. She didn't tell.
Yes. I think the network is bad. Can you hear me, Lilian? Network. Guys, I think the network just went bad. Okay, she left. Okay, guys, as we were saying, I think the network went bad and she left. So I have to wait for her to join again. So we'll continue this live video. Lilian, please, if you're here, if you're hearing me, please request again so you will join because the conversation is just getting started. Okay. Okay. So guys, we've been talking about sexual health and Lilian has been telling us a lot about sexual health. But now she went off. I think her network went bad, but she'll join us soon. Okay, so as we wait for Lilian, she mentioned so many things. She said something about young girls being coerced into having sex and other things. And the thing about sex education in Nigeria is that it's very difficult for you to see people, parents especially, talk to their young ones, tell them about sex. Sex education is very important, but so many people shy away from them. But today we'll talk about it. I asked Lilian about it. Okay, she's back. Uh, Let me accept her so we'll go live again. I'm sorry for that short interruption. Okay, so if you have any questions, you can actually post it and Lilian will answer them if she comes back. If I have the answers, I'll also answer. Okay, welcome back, Lilian. I'm very sorry. I think the network was
I'm
bad.
so sorry about that. The network was crazy. So, like I said, just a personal example. So,
Okay.
my mom attended this conference and started talking to me about it, and I became knowledgeable
Okay.
on it. So, the thing is, like I said, the grassroots parents are not actually telling their kids what they need to know. It's so much. It's so little for you to tell your child.
Yes.
Okay, oh, if a boy touches you here, say no. And you get pregnant. That
Yes.
was the orientation we had. When I started having my period, my mom told me,
Yeah, that was
if a
the
boy touches
orientation.
you, yes, if a boy touches you, you're going to get pregnant. But you don't tell a child that, okay, this is why.
So Chisi, yeah, you get pregnant. Yes. Yes.
That this is
Mm-hmm.
what is right and this is what is wrong. Don't let a guy touch you, one. If he
Yeah.
touches you, don't let him take you to somewhere that is hidden. If you want to have a friend, bring the friend home. Let's
Yes.
get to know the friend. Do you understand? Now, we notice that these days,
Mm.
young girls are being coerced into sex. They're being, they'll tell you,
Yeah.
sorry, I'm sorry. No offense to the men. You're my sugar and my tea. You are everything. You are everything. That's not the problem.
Yeah.
But please,
Of course.
why you are doing that, please do the young girl the how do I put this, do her the honor of making sure she's okay after the act. Now,
Yes. Of
young
course.
girls should be
Consent. Yeah.
told that these kind of things are wrong. If you cannot shoulder the consequences, don't do it. That is it.
Yeah.
Everything in life comes with consequences. The fact that you live a certain way has consequences. If I live right, I do what I'm supposed to
Mm.
do. The consequences that will come in front are like, okay, I'm going to live a good life. But if you do something wrong, the consequences are damning. So why would we allow our young girls? Why don't we
Yeah.
teach them? They are not taught. They are in schools. They are not taught. Teachers don't
Okay.
teach
Yeah.
them.
Before
If you see a child,
excuse me, Lilian. Before you continue, someone asked a question. The person said, "What's the best way to present sex education to kids?" Someone asked the question now. So, what's the best way to actually present this topic to kids?
the best way to actually present sex education to kids is sit your child down and have an intimate conversation with them. Ask them, does any guy like you? Or do you have any friend that is a guy? What's going on? Make your child your friend.
Yeah.
Once your child is your friend, anything goes. And I mean, even as an adult, as I am now, I tell my mom anything.
Yeah.
Child is not your friend, there is no way that that child can tell you what is going on. So cultivate the relationship of asking your child intimate thing, what is going on. If the child does anything wrong, you don't be so quick to rebuke the child. Rebuke the child with love. If a child knows that I can run to my mom if there's anything, the child will, no matter what happens, that child will run to you. But if you're so quick to rebuke your child all the time without love, the child will run away. So you will not know anything that's happening in that child's life. So the best thing to do is rebuke your children with love. Have these conversations with them. Tell them, I'm not saying you give them the full-on information, no. But tell a child what a child needs to know. That, okay, this is wrong. This is why. Give the child examples. You can decide to paint, a moral picture for this child. And when we've seen that when children, see these things or hear about them, they are aware, they are conscious. If they go out in the world and somebody tells them, okay, you're the sugar in my tea or everything, the child will know, okay, my mommy told me this, and that this is the caution that would happen, or this is what would happen. The child will restrain that, and you see that child will come and tell you. I've had a client like that. She was 16. So all of a sudden, her mom brought her. She's like, she doesn't hear words like this. And I'm like, Ma, that's not how to start with this child. She's a teenager. She wants to experience what the world is all about. And now you have to make sure that child can be able to trust you, even as he or she is in the world. You have to make sure that you make that child your friend. Tell your child to tell you anything that happens, that you are not the judgmental parent. You have to be able to take your child like yourself. You see you see yourself in your child, and the way you were while growing up as a teenager, you have to be able to relate with your child that way. So I feel not actually rebuking your children with love, sitting down and having a conversation with them, gaining their trust, because it's very difficult for parents to gain, especially African parents, to gain the trust of their kids. So paint a moral picture to your child, telling and detailing the child on the consequences of these kind of actions. So that's just all about it.
Okay, thank you very much. Thank you, Kratos 300 for that question. If anyone else has a question for her, you can send in the question. So, yeah, is there anything else you want to say about the sexual health, the topic we have today? Because you said that you just started, so I'm just giving you the audience. Just tell us, we need to learn more.
So, one of the major things that comes with this, because this is born out of a passion, I get to see clients working, young people, and they come in and tell you they just had sex and they want to get something to take out the repercussion of it, remove the child, or flush their systems or treat infections and all that. And I looked at it and I'm like, why aren't people informed about this? I know we're informing people to take care of themselves, exercise, eat the right food,
workout, fitness.
Why can't we give people this information? And the major thing I'm going to talk about today basically has to do with, one, antibiotic abuse amongst young people, especially for STIs, lack of personal hygiene. Another thing we're going to be talking about is actually everyone, hands-on involvement in your sexual health. I feel sexual health is about owning it, owning your sexuality, owning everything about you. It's not just taking care of yourself, not just going to the gym. What you do during, before, and after the process. We've seen that ads have said abstinence, abstinence, abstinence. But we see that this abstinence, nobody's listening to it.
Yeah.
You're telling a young person in the 21st century to abstain from sex, do the right thing, use protection, and nobody's answering you. And then they come in back to the system, back to we that are pharmacists, that are doctors, that are healthcare professionals, because we have that duty to be able to make sure our patients, our clients are of optimal health. Now, you see these things happening day by day, and you ask yourself, why is it that our people are not informed? Why is it that they don't know that this is this and that is that? So first of all, I'm going to start with the antibiotic abuse. Now, I'm going to leave this as something that we can all gain from, regardless of whether you're sexually active or not. Now, when you come into a hospital or the pharmacy, and you tell me you're having malaria and typhoid, and you ask me for anti-malarial, and then you ask me to give you an antibiotic. Most people, I don't do that. I'm so sorry. I don't do that. I don't give you an antibiotic when I am sure that you're having malaria symptoms, or you haven't even run a test for me to give you an antibiotic. But you see, this is the thing. It's not all healthcare professionals that can think like me. Now, I don't give you antibiotic except I am sure, one, that you have run a test to that effect and it has been prescribed by a doctor. Antibiotics are not over-the-counter drugs. They are prescription-only drugs. But the way our people misuse and in fact, the abuse, they misuse it is alarming. You see someone come to the pharmacy to tell me to give them ampiclos, not just the required dose, but 2 tablets. And you want to what? Flush your system. Like, okay, you take 2 tablets of ampiclos today. Next week, you go and have unprotected sex. You come back again and take another 2 tablets. Then tomorrow, maybe you have a major reproductive ailment or an infection or a UTI or STD. And then you go to the hospital. And then they run a test on you. And they find out that that microorganism that is in your body that is causing that infection is actually resistant to the ampiclos that might be able to save your life. And resistant to all other antibiotics. What would we now do? And the burden will rest on the healthcare professional to find a solution. So do we wait until it is overdue, Abi? Do we wait until it is too much for us to handle?
It becomes a big problem.
In the aspect of sexual health, people come into the pharmacy or into the hospital and they're like, give me this, give me that, and I'm like, excuse me, what happened? Have you run a test to that effect? Why would you actually have unprotected sex, first of all? What happened to protecting yourself? What happened to how much is condom? People don't get that. And that is where it is so painful. So please, the take home today is please stop abusing antibiotics. They were made for years and years of research and development to be able to eradicate microorganisms which causes infections, diseases in our body. There are 2 types of, basically, we have antifungals, we have antivirals, we have antibacterial, antiprotozoans, but for antibiotics, basically for bacterial infections, we have drugs that are what we call bacteriostatic and drugs that are bactericidal. Now, bacteriostatic reduces the amount of the microorganism in your body, while bactericidal kills that that microorganism. Now, you see people taking bacteriostatic drugs for bactericidal use. Is that not?
Yeah, because they don't even know. They don't know. You understand?
No,
they have no idea.
Information out there. We every year we talk about antibiotic resistance. We talk about antibiotic use, misuse, and abuse. But people don't get to understand this information. You don't take antibiotics anyhow. You only take them on prescription basis. And when you are done running a test, and it has been shown, you bring it to your prescriber or you bring it to your healthcare professional, and the person is like, this is the antibiotic used or approved or that has been said and shown that this is the antibiotic that is preferable for this kind of infection or this kind of ailment. Please do not use antibiotics anyhow. The abuse of antibiotics can mar you for life. And what I mean for life, I mean for life. Like you might have an ailment now that ordinary the abuse of flagyl.
Flagyl. Yes.
I'm telling you, somebody might have diarrhea now. He'll tell you, oh, I want flagyl. And I'm like, ma, you don't need flagyl. You don't need flagyl. And they'll tell you, that's what has been working for me. They don't know that flagyl you're supposed to be taking, you don't take 1 tablet. Flagyl is given, flagyl 400 milligrams is taken, 1 tablet is taken every 8 hours. But you see people taking 1 in the morning, 1 in the night for diarrhea. And you're telling them, why don't you take an anti-diarrheal agent? As long as diarrhea has not gotten to a place where, you have to get too concerned about your GIT health. And then they'll tell you, no, I know what I'm doing. I know my body. I know my system. Nigerians.
Yes, that's one thing Nigerians, they'll always, I know my system, this works for me. They don't even care whether it's actually good. They just
I know my body, I know my system.
Yeah, I know my body.
I know my system syndrome. Imagine how painful that is, having to attend to a client and the person leaves with the wrong medication. I can't give you the wrong medication, so you have to just go. I
Yeah.
can't, because, I want to sell, I want to make sales, I want to make
Yeah.
money. No, make sure you have optimal health. So please, antibiotics are harmful when taken in the wrong doses, but they can be helpful to you. In pharmacy school, we're taught that every drug is a poison. The difference
Yeah.
between a poison and how much it helps you is the dose. So why
Of
would
course.
you take an antibiotic when it is not needed? When you don't have typhoid, you go and start, and you take the wrong ones for that matter. So when you now
Mm.
come down with a serious ailment that antibiotic can solve the issue, it will not
Yeah.
now work. And you will not
Yeah.
start running helter skelter and saying your village people did you. It
Yeah,
doesn't
I
make
think some
sense.
people actually think that all antibiotics are the same. You understand? Like
They are
every
not the
antibiotic.
same.
Yeah, yeah, of course, of course. I know they're not the same. I study industrial chemistry. But some people, if not, I wouldn't have known. Even what you just said now, I'm like, so it's not even over the counter medicine. You understand? Even for me that
I'm
actually
not
studied in of course, yeah. So people are not aware. They are not actually taught. They don't have aware of this antibiotics abuse and the rest of it. So I think it's something. What do you think should be done about it? Because some people who sell drugs, they're just doing it. I want to make my money. If I don't sell this thing, someone come in and ask you, I want to get this. You're not even asking the person why. What's wrong with you? You just open it. I want sundress. You just open it. I want flagyl. You're supposed to like ask the person, what is there any problem? Of course, you just enter a pharmacy like you just tell them I want this and they'll just give it to you. Understand? I don't know if it's just Nigeria, but I think people who sell this drug, they just want to make their money. Some of them, of course, there are good people. There's some people that will ask you, no, what are you doing with this drug? You understand? So what do you think is the issue? What can be done to actually create more awareness to this drug abuse and the rest of it?
So I feel, for me, outside Nigeria to the Western
Yeah,
world, drug, as how do I put this? Dispensing of drugs actually controlled. But for
yeah,
Nigeria, I'm so sorry to say, like, our system is quite, the system is, I think I'm going to tilt towards rotten. I'm sorry I'm saying this, but it is time the healthcare sector wakes up, especially the
yeah,
pharma industry, because if we don't put measures in place to
mm-hmm.
stop pharmacies or chemists from giving
Yeah,
people these drugs except on prescription basis. There are some
yeah,
people who would come and tell me, okay, Pharm, I want a particular drug. I want codeine. I want cocodamol, which is tramadol and codeine. And I'll
yes,
say, I can't give it to you without a prescription. And they'll be like, I've been taking it. No. So
yeah,
drugs, we need to put that measure in place, those laws in place, that you don't get a drug without a prescription. You don't get a non-OTC drug, that's a non-over-the-counter drug, without a
without
prescription.
prescription.
So
Yeah,
if we put those laws and those rules in place, we would see that the healthcare system would actually blossom. Our patients will
yeah,
get the right medication. If it's not prescribed for you, you can't get it. You won't then harm yourself, because we're trying to make sure that you do the right thing for yourself. We wouldn't
yeah,
want you to die. We wouldn't want you to run into, more harm. So hence,
yeah,
laws and rules should be put in place that, except you want an OTC drug, every other drug,
yeah,
you should we should actually
mm,
be able to know we should actually be able to know the doctor that is prescribing. We should actually be able to know that, okay, we can keep tabs on the doctor, we can keep tabs on you, follow up. There's something we're not doing as pharmacists called pharmaceutical care. So aside from dispensing the drugs to you and providing you with drug information, we actually follow
yeah.
up on you. We actually follow up to make sure that, okay, the drugs that have been dispensed to you are doing exactly what they need to do.
What they're
If you're
supposed to
having any
do.
side
Yeah,
effects, you can relay it back to us, and then we can discuss with your doctor. So you see, the healthcare system is like, we're like a group of people working together for the good of the patient, regardless of whether you're a
yeah,
doctor, a pharmacist, a scientist, a radiographer, whether you are a physiotherapist. We're all working
mm,
hand in hand to be able to make sure that you, as the patient, you have optimal health. So I think
okay.
that's just about that.
Yeah. I think your network is bad. I don't know if it's my network or your own, but yeah. Okay, is there anything else? Like, I've learned a lot from you. I'm sure our viewers have learned a lot from you. So is there anything else you have to say, the final words that people have to take home for people? What people have to like take home
Okay.
from this conversation?
Um, your healthcare professional is always accessible to you.
Mm-hmm.
Now, I
Okay.
believe one thing we lack as Nigerians and as Africans in total is we don't like listening. Knowledge, they say, is power. I believe every healthcare professional is taking out time to give you the required information you need for your health, as in to make sure that you are of optimal health. So please, while they are doing that, please help them and listen and do what is right. Don't go to a pharmacy and get a medication that is not required for your health. Don't complicate issues and start, looking for who to blame at the end of the day. Please and please, when you do something, remember that every action has consequences. Take care of yourself. Walk into a pharmacy. A pharmacist or your doctor is always going to be available to give you the right information anytime, any day. So don't self-medicate. Don't say, okay, this is what works on my body, so therefore I have to take this. Or don't walk into the pharmacy and meet me, especially me or from Lilian, and come and tell me, Pharm, this works on my body. I will tell you it doesn't work for you. And if you're not okay with it, your life will not be, whatever happens to you will not be on my head. Because I have to have a conscience as a person. It's not enough to take your money. What I have to give to you for that service that you're paying for is that I have to make sure that you are good, you are fine, that the medication you're being given works for you appropriately. So please help us to help you. Help every healthcare professional to help you. Don't self-medicate. If you have a problem, pharmacies are readily available, hospitals are readily available. Walk in there, and every healthcare professional will make sure that you are good. Like, they would give you every information you need. Ask questions. That is why we are there for you. Ask questions.
Can you quickly answer this question by Kratos 300? He said, can doctors or pharmacists be reported if seen aiding self-medication? What do you think?
Yes, they can.
Is this something?
Yes, they can. Yes, they can. Doctors and pharmacists can be reported if they are aiding self. And I don't think any doctor or pharmacist in their right minds can actually aid self-medication. Because one, we actually look at the patient's symptoms and we ask on basically past history of ailments or medication history. What have you been using? If you walk into a pharmacy now, one thing the pharmacist should be able to ask you, I'm talking about my own profession, we're supposed to ask you, okay, what drugs have you been using before? Have you had this before? How long did it start? So these are the questions we ask. Every doctor, every pharmacist, every healthcare professional asks, like, what happened before? What were the medications you were taking? If those medications are not working, if it's something that a pharmacist cannot handle, we refer you to a doctor. We are not doctors. We only aid. We are all like in a system, in a group, trying to make sure if this is not working, we refer you to the next person. And the next person sees that, okay, this is what is required. And then, everyone works hand in hand to make sure you as a patient is fine. So any doctor, any pharmacist that is actually aiding self-medication should be reported. And that is it. You can't kill a patient because you want to make money. You can't. If you swore an oath to actually protect the lives of people that have been entrusted into your hands, people who are not feeling okay, who are not well, and you have been tasked with that duty, I believe you should be able to do it to the best of your ability. Why aiding self-medication?
Thank you very much, Lilian. Thank you for coming to the show. I learned a lot from you today, and I'm sure our viewers learned a lot from you. So so this is it for today, guys. Thank you once again, and we'll see you next time. I don't know if you might be a guest next time, so you teach us more on what you know. So thank you very much. We'll see you next time. Thank you.
Bye.
Okay. Bye. Okay, guys. You've heard from the pharmacist herself. She gave us so many things to actually take home and think about. She gave so many reasonable points, and we thank her so much for actually being a guest today. So, guys, this is it for today on Picking Brains. I'll see you next time, I hope. Thank you so much for joining us, and see you next time. Bye. Don't forget to follow LDE TV on Instagram, YouTube, Twitter, everywhere. Just follow us for more content, and we'll keep them coming. So thank you so much, guys, and bye. Bye for now.